Hello everyone. Welcome back to this channel. Before we begin, don't forget to support us by subscribing, liking, sharing, and leaving your comments below. Alright, today I'd like to invite you to talk about a topic that isn't discussed very often, but is actually very important for our health. And that is sexually transmitted infections or STIs. Many people only start paying attention when the problem has already become serious. But in fact, the early symptoms of STIs are often subtle, vague, or even go completely unnoticed. And that's exactly where the danger lies, because when those early signs are ignored, the infection can progress, spread to a partner, and cause long-term complications. Before we get into the symptoms, let's understand the bigger picture. According to the World Health Organization, or WHO, more than 1 million new cases of sexually transmitted infections occur every single day worldwide. That means every second, several people are infected. And here's the reality. STIs do not discriminate. They can affect anyone, regardless of age, gender, or background. If you are sexually active, you are at risk. Some of the most common STIs include gonorrhea, chlamydia, syphilis, trichomoniasis, genital herpes, HPV, and HIV/AIDS. Each of these conditions can show different early signs. 1. Pain or burning sensation when urinating. This symptom is often mistaken for a simple urinary tract infection, but according to the Centers for Disease Control and Prevention, CDC, painful urination is one of the early warning signs of gonorrhea or chlamydia. In men, it often comes with discomfort at the tip of the penis. In women, it can also cause pelvic pain. If this symptom is accompanied by unusual discharge, it should not be ignored. 2. Unusual discharge. For men, a white, yellow, or greenish discharge from the penis is a classic sign of gonorrhea. For women, vaginal discharge that is foul-smelling or frothy may be linked to trichomoniasis. According to Mayo Clinic, changes in texture, color, or odor of genital discharge are among the earliest indicators of a possible STI. That's why it's so important to know your own body's normal pattern so you can quickly notice when something is off. 3. Sores, rashes, or bumps in the genital area. Syphilis often begins with a small, painless sore called a chancre. It can appear on the penis, vagina, mouth, or anus. And because it doesn't hurt, many people overlook it. But this is actually the most contagious stage. Genital herpes typically starts with tiny fluid-filled blisters that break open and become painful sores. HPV, on the other hand, can cause genital warts. According to Johns Hopkins Medicine, many patients only seek help after these lesions become severe, even though early treatment could greatly reduce transmission. 4. Persistent itching or irritation. Itching in the genital area is often thought to be a simple yeast infection. But if it comes with a rash or pain during sex, it could be a sign of trichomoniasis or herpes. In women, chronic itching may also be linked to certain types of HPV, which in the long run can increase the risk of cervical cancer. Early testing is crucial to distinguish between mild infections and more serious conditions. 5. General symptoms that are often overlooked. Beyond local symptoms, some STIs show up as more general signs. Mild fever without a clear cause. Swollen lymph nodes in the groin. Persistent fatigue. Joint pain. According to the British Association for Sexual Health and HIV, these non-specific symptoms can sometimes indicate early HIV infection or advanced syphilis. Now, why is it so important to recognize these early signs? Because many STIs can be treated effectively if caught early. For example, gonorrhea and chlamydia can be cured with antibiotics, but if left untreated, they may cause permanent infertility. Syphilis, when ignored, can damage internal organs, including the brain and heart. And HPV infections, if undetected, may develop into cervical or anal cancer. So what should we do? 1. Know your own body. If something feels unusual, don't ignore it. 2. Get regular checkups. WHO recommends routine STI testing for sexually active individuals, especially those with multiple partners. 3. Use protection. Condoms remain one of the most effective ways to prevent most STIs. 4. Seek medical help promptly. The sooner an infection is treated, the lower the risk of complications. So, friends, sexually transmitted infections are not a shameful secret, but a very real health issue. Recognizing the early signs can protect yourself, your partner, and the people you love. Remember, never ignore the small signals from your body. Health is a lifelong investment, and that includes the health of our intimate organs. I hope this discussion has been helpful. Stay healthy, stay aware, and see you in the next episode.